It is my pleasure to introduce the April 2013 issue of the Journal of Arthroscopy. This issue contains a diverse variety of articles with 19 original articles, 2 systematic reviews, and an editorial discussing several of the key studies in this issue. 2 articles discuss orthopedic outcome scoring systems. Scoring systems are vital to orthopedic research. They allow us to look at the results of different techniques and procedures and compare them more easily. Many of these systems have different strengths and weaknesses. Van Meer and his co-authors discuss whether the KOOS or IKDC is the most useful scoring system to monitor the short-term outcomes in patients with ACL ruptures, while Chen and his co-authors present a new shoulder scoring system that not only incorporates the usual objective findings, but factors in subjective findings based on the view of the patient as well as the physician. Complications are inherent to any procedure we do. 2 articles in this issue look at the complication rate associated with arthroscopic knee surgery. Bohinski and al. reviewed the adverse outcomes associated with elective knee arthroscopy using a population-based cohort study, while Zhang looked at the incidence of deep vein thrombosis after arthroscopic-assisted ACL reconstruction at one institution. Both of these articles remind us that surgery is not without complications, and the surgeon should be well aware of them, explain them to our patients, and take the necessary steps to prevent them, recognize them, and if they occur, treat them appropriately. In addition, there are 3 other articles involving biomechanical evaluation of different surgical techniques and other fixation devices. There were 2 studies looking at shoulder procedures. Wellman and his co-authors examined the biomechanical comparison of open versus arthroscopic Larijet procedures, while Aurora looked at the biomechanics of 4 different devices used in the subpectoral biceps tenodesis. The other article by Lenschow examined the fixation strength of 5 different techniques for graft fixation at the patella for medial patellofemoral ligament reconstruction after patella dislocation. These articles can assist the surgeon in fine-tuning and optimizing their techniques with respect to the procedure. There were 2 systematic reviews in this issue that I recommend reading. The first is Ayani, who reviewed the consistency of reporting outcomes following arthroscopic management of femoral acetabular impingement. The study highlights the need for consistent outcome reporting following this procedure so as to make studies of the FAA procedure more easily comparable. The second systematic review by Butt examined the literature on the early results of arthroscopic cord transfer in the treatment of recurrent shoulder instability. They felt that this procedure can be technically demanding and recommend gaining experience with open techniques and doing cadaveric training prior to proceeding with arthroscopic one. Another group of studies in this issue presented the use of biologics to regenerate cartilage or reduce pain in osteoarthritic knees, and is complemented well by an editorial from our Assistant Editor-in-Chief, Dr. James Lubowitz. The first article, Choi and his group, showed that mesenchymal stem cells, when injected with a mixture of platelet-rich plasma, improved symptoms of knee osteoarthritis after arthroscopic debridement, while Mazaka and al. evaluated the anti-inflammatory effects of platelet-rich plasma, ketorolac, and methylprednisolone by looking at cellular inflammatory markers. The third article, in a study by G, was a randomized controlled study that showed articular cartilage regeneration after the intra-articular injection of autologous peripheral blood stem cells and hyaluronic acid after arthroscopic subchondral drilling. In his editorial, Dr. Lubowitz discussed the issues of stem cell therapy and believes it will allow unprecedented tissue healing and repair in the future. There are many other informative articles in this issue, but I cannot mention them all, and I recommend to you to carefully review them yourself. For your iPhone or iPad users, please download the Arthroscopic Journal app so you can get the journal on your mobile device and conveniently be able to read it almost anywhere. Thank you.